Well, thank you ever so much for having me in Australia. This is my first visit here ever, and it's a great privilege to be amongst a wonderful group of professionals, as I know the Australian profession is here. And this is really a story of my journey in Chinese herbal medicine, and in particular in some of the things that I learned along the way in relation, for example, to dose. And in 1982, 83, I was introduced to the subject of Chinese medicine, Chinese herbal medicine, at a time when there were no textbooks in the UK on Chinese herbal medicine whatsoever. There were no herbal importers. There were no wholesale Chinese herb importers. And actually, the man who's responsible is sitting on the second row here, Mazim Al-Khafaji, who secretly discovered Chinese herbs at a time when it was unknown in the UK. And he inspired me at the same time to start to look into this. At that time, the only way you could practice Chinese herbs was in the UK was to befriend a Chinese clinic in the Chinese community in London or Manchester and persuade them to sell you Chinese herbs, because there were no importers then. So that's what I did. That's what Giovanni did in London at the same time, and a couple of other people. So we were pioneers. I was going into this shop not really knowing what I was doing, and I was buying some loose herbs, and I would see all these Chinese patent medicines as well, with no English on there at all, and not really knowing what I was doing. I'd say, oh, I'll have a bottle of that, bottle of that, bottle of that, bottle of that, bottle of that. And then I'd go home and get a dictionary out and translate the labels on these things. So it was like archaeology. It was like exploration for me at that beginning time. And so when I went to study with Ted Kapchuk later on, I said to my wife, this is, from a commercial point of view, this is completely pointless. Nobody's ever going to phone up and ask for Chinese herbs off me, because it was just so outlandish. And here we are in a world now where it's grown enormously. So this is really about my study of the dosage issue in Chinese medicine, Chinese herbal medicine. And we go to college and we learn what the teachers say, and then we go into practice and we start to learn what the clinical realities are. So there's that relationship of having experience, and then after we've got experience, we can have insights. And for 7 years, I employed a Chinese doctor from Shandong, and I once asked her, I said, what's the difference between a master Chinese medicine practitioner and the likes of me? And she said, well, a masterful Chinese medicine practitioner has had a lot of wu moments, a lot of insight or enlightenment moments in the clinic. And I think that's very wise. I think that's really interesting, that's how you become better and better at this. And just to mention one random one, 25 years ago, I remember looking at a 7-year-old girl's throat who'd got chronic tonsillitis, which in Chinese is called throat moth. And I could never understand why chronic tonsillitis should be called throat moth, until I looked down this girl's throat and could see 2 big red swollen tonsils and a narrow trachea in between. And I suddenly realized it was the shape of a moth. And that's just one tiny little wu moment. And as we practice, we have hundreds or thousands of these, perhaps some of them unconscious and some of them conscious. So that's the way we become expert. And that's really what I want to talk about today. So the question really is, can we get the diagnosis right and our prescription right, but the dose wrong in such a way that we don't benefit our patients? And one of my favorite physicians from Chinese medicine history is, of course, Sun Si Miao, and he famously said, yi shi yi, medicine is yi, as the yi of the spleen. And actually, it occurred to me that medicine is a lot of other yis. Medicine is a yi in Chinese. Medicine is also about transformation and change, the yi of the I Ching. So what I'm getting to is yi, is yi, is yi, is yi, is yi. We could go on forever with all the different yis. If you're a Confucian, then medicine is righteousness and justice and honor. The way I like to translate the yi of the spleen is high cognition. That what Sun Si Miao meant was that the practice of medicine is the practice of high-level cognition, raising our perceptual acuity to the point where we develop a kind of intuition. But here, the E I want to talk about is appropriateness, because the question of dose is really what is the question of appropriateness. In the clinic, what a masterful practitioner can do is know exactly what the most appropriate thing is that can happen to that patient in front of them at that moment in time. And that's different from just doing what you always do on everybody. And a wonderful story that Ted Kapchuk told me from Sun Si Miao. Apparently he had a case of a lady with, this is a story about an ant, a lady with facial paralysis, an elderly peasant lady with facial paralysis who came in, and Sun Si Miao looked at her eyelids and took her pulse and said, the reason you have this problem is because, unbeknownst to you, an ant walked across the shadow of your head, and that's why you've got the facial paralysis. So she said, well, what do we do about that? He said, come outside, and he sat her down in the sunshine outside and took an ant and got the ant to walk across the other way across her head. Now, the point is that you could write this down. I notice nobody is writing. Oh, somebody's writing it down. You could write this down, and you could go, hey, facial paralysis, tip from Sun Si Miao. I'll just, the ant diagnosis. That's not going to work, because that's not appropriate. The thing that made that work for Sun Si Miao was that he knew what was the appropriate thing to do. He knew just the point to touch that would touch that woman and affect her in a positive way. And so that's really what expert physicianship is about, doing the most appropriate thing to patients, and that includes dose. So in a sense, appropriateness, people talk about the practitioner's Shen, and we do all the Qi Gong, and we do harmonizing Jing, Shen, and Qi, and we get into the philosophy. But really, ultimately, in medicine, it's about appropriateness. It's about being appropriate. And that's what our Shen, a good practitioner's Shen, is about being appropriate. The more appropriate your treatments are, the more masterful they are. So first of all, I copied the People's Republic of China style. I went to China to study, and I kind of copied their dosage, I copied their way of behaving. But there's something niggled, because I would treat patients sometimes with patent pills, and I thought, well, hang on, how much Shu Di Huang is in Bargentang, in one of those little round pills that roll across your kitchen floor? The actual weight of Shu Di Huang is minute. How can that do anything? How can that actually have a pharmaceutical effect? So I came to the conclusion eventually, to cut a long story short, that sometimes what's most appropriate is to use a low dose, and on other occasions it's a high dose thing that we need to do, quite higher than normal doses to make it work. So I began to get a few patients that were forcing me to think about this. So this was a lady, Lorraine, who was a professional actress who saw me, and she got signs of phlegm damp. She'd got sinus congestion quite chronically. She'd got lumps in her breast as well, fibrocystic disease. And so I thought, I know what to do. I've read all the Chinese medicine textbooks. I gave her a prescription based on something like Ping Wei San. So here you go, and with Baijia added and Tang'erjia added to dry that damp. This is what Chinese doctors tell me I should be doing. And she came back after a week. I said, how's that doing? Is that beginning to dry those sinuses out? Yeah, she said, it's really good. In fact, I woke up at the middle of the night, trying to peel my tongue off the roof of my mouth. It was just inappropriate. I was trying to change her in a week, when in fact it was not appropriate to do that. The timescales over which she could change were different from the timescales that I was thinking of. So that was something. So I stuck her mouth, glued her mouth up. Another time I saw a chap with dry eye syndrome, and I treated him with acupuncture for a while. It got quite a bit better. And then rather than continue with the acupuncture, I gave him, which one was it? gave him Dihuangwan pills, the Chinese, the Lanzhou pills. And I said, just continue to take these, take whatever, 12 twice a day to start with, but then take the dose down, and I'll just see you once a month for acupuncture. Eventually, he was taking one pill. He said, one pill a day, he said, if I don't take that one pill, my eyes begin to dry again. Now, actually, I'm not a great believer in the placebo theory, but that's another. There's some truth in the placebo thing. I think it's a magical belief on the part of modern pharmacology, the whole placebo story. But I will skip over that for now. So, and how come yin chow pills work so well? There's hardly any Jin Yin Hua in one of these pills. How the hell do they work? They really do work well, but there's so little in there. I treated this lady with Parkinson's disease, and she was primarily blood, and your blood deficient signs she was showing, and some yin deficiency signs. So I gave her this prescription to take, and these were 2-day bags. These were doses for 2 days, and so I was giving a 10 days supply, and I wanted her to phone me up just to tell me how well she was doing. She phoned me up. I can't take these pills. This prescription. She said, it's terrible. It tastes awful. Oh, no. And I really didn't want the bother, so I just said, well, I'll tell you what, just take the stuff, put it in an ice cube container, freeze it, and just take as much as you can, 1 ice cube a day or something. She phoned me 9 months later to say, oh, I'm running out of the herbs now. These were enough herbs for 10 days. Now, I didn't believe this. I couldn't believe this. So I said, well, now I hadn't told her what I was doing. I hadn't told her about Chinese medicine, blood deficiency, or hadn't told her the diagnosis or anything. I said, well, tell me what's changed. Well, she said, my hair has got more texture, and my hair's growing better, and my skin feels softer and gone brighter. And my nails, she said, were really cracked before. And she gave me all the list of all the things that prescription was supposed to be doing. Even though she'd been taking a tiny fraction of the dose. And that's because that was appropriate for her. It may not have been appropriate for everybody all the time. So these sort of things really got me thinking about the dose question. And I thought, do something bloody different. Having taken so many patients with sinus problems and phlegm and thrown all these bags of drying herbs at them and not winning, I remember I had 3 new patients with that syndrome booked in 1 week. I don't want to do the same again and fail. So this time I said, right, I'm going to do right the opposite. I'm going to say to the patients, this isn't going to change in a matter of weeks. We're thinking in terms of 3 months, 6 months, 9 months, a year. And I gave tiny doses. And this is one patient, Mr. Fox, who was wonderfully chronic. He was a football referee, and he'd had sinus problems from the age of 8. For the last, I can't remember, 10 years or so, he'd had complete nasal obstruction. He couldn't breathe in through his nasal passages at all, ever. He'd got chronic headaches, frontal headaches. No smell or taste at all. Dry mouth and throat, encrusted, dried phlegm in the nose, and he had some phlegm on the chest as well. So I said to him, I'm going to give you this prescription, and you're not going to see any difference for a week, 2 weeks, probably a month, 2 months even, but I want you to stick at it. So the prescription I gave him, well, the diagnosis I decided was congested heat in the lung channel, that there was lack of clear qi ascending, that there was damage to lung yin and fluids, and the lung dispersal function had been impeded as well. So as with these chronic cases, a little bit of a complicated diagnosis. So the prescription I gave him, and this was 1 bag for 10 days, so it's in the region of 1 gram of each of these things per day. I won't go through the details of it. I was trying to clear lung heat, I was trying to move stagnant qi, transform hot phlegm, send clear qi up, move lung, fragrantly transformed phlegm damp, direct the qi upwards to help clear the sinuses. And that was when I was doing nourishing yin a little bit, opening the orifices. So after 2 weeks, he began to feel his sinuses clearing. And he was, after a few more weeks, he was beginning to get flashes of smell, just momentary return of his smell again. 3 months, his nose was completely clear and could smell again. And that did it. I think I continued for about 6 months altogether, and that completely fixed him. It would not have worked if I'd given him like the Chinese hospital doses. I would have lost him, like I did so many before. Very satisfying to do that. And when I've given this lecture sometimes before, patients have assumed, practitioners have assumed that I must be Mr. Microdose. I'm not. I'm Mr. Appropriate Dose, and that sometimes it's more appropriate to give a higher dose than is the textbook normal. And I had a long-standing ME patient once who developed a chronic coughing up blood. She was one of these patients that brought bits of blood on a tissue paper for me to look at, the streaks of bloody sputum that she brought in for me. But she'd also got long-term post-viral fatigue, and so it was a little bit difficult to treat her. So I included in her prescription 18 grams of Huang Qi a day in the hope that that would stop the other clearing herbs from knackering, from, what's the word, Australian word for knackering? You have knackering in Australia? And I gave her some Huang Qin to clear lung heat. And the first week I did this, it didn't make any difference at all. She was disappointed. It hadn't changed nothing. And then the next week, I knew the prescription was right, so I repeated it again. And she came back with spare bags. She said, I don't need these bags because after 3 days, it completely cleared. I'm thinking, what's going on here? So I opened up the bags that she'd brought back, and my pharmacy had accidentally put 18 grams of Huang Qin in the prescription and 9 grams of Huang Qi. The prescription was otherwise the same. By doubling the Huang Qi to a higher dose than most Chinese doctors would use, then that worked in 3 days. So I'm not saying that we should all use tiny doses. I'm saying that when we do medicine, we should be as appropriate as possible. So from about 1990 in Britain, we had an explosion of interest in Chinese medicine and dermatology. Sadly, I've been massively overtaken by this bastard over here since then. I'm happy, sorry, I don't mean to be rude. I'm delighted to see people do better than me in anything, really. But what I found was that in dermatology, if you give 9 grams a day of Shengdi, it hardly does anything. Do you feel the same, Mazin? Yes. Yeah, but I thought you would. We need to give 12 as a minimum, perhaps 30 grams a day of Shengdi Huang to have the dermatological effects that we need. So we can learn from our experience, we can learn from other practitioners, we can learn from the tradition by reading the tradition better, and we can also learn from science to some extent as well, I believe. So what does Chinese medicine history tell us about those? Well, if we look at Xiaoyaosan, this is a modern standard hospital dose of Xiaoyaosan. And if we look at the source text, we find that in the source text, the doses are 1 gram of each of those things. So they were using low doses sometimes historically. Okay, this was from a time when most prescriptions were powdered, so these are raw herbs powdered. But still, that's still a lower dose than we use today. So Zhu Danxi, you've always got to quote a few Chinese classics, haven't you really? So Zhu Danxi, famous Jinyuan doctor, is reported to have said that his colleagues had criticized him. Your prescription is well considered, but how slowly it works. Patients must be tired of your indirect ways and crave a quick fix. Well, sometimes you can't have a quick fix. So Zhu Danxi said, this illness arose years ago. Its roots are deep and its condition is bad. Seek rapid effects and we invite disaster. Only those who know the sagely Tao are able to treat this disease. And that's the same thing with those chronic sinus things. You can't treat them in a week or 2 weeks. Xu Dachun said something different in 1710 when he was around, 1757. When the ancients prescribed, they never gave extreme doses, but in the last 20 years, doctors have followed the fashions of their times, wrongly interpreting ancient prescriptions by heavily increasing doses. And he also said, doctors toss herbs into patients and fail to get results. They doubt their actions and try another prescription. Even though the first was right, it simply hadn't had enough time to work. Then they try mistaken herbs. The more they change things, the more serious the illness becomes. This is exactly what my experience told me. So I concluded some patients do better on low doses, some patients need higher doses than average, and we need to work on what's appropriate. The problem is partly that today we see where our minds are trained in pharmacology, in the way that pharmacology understands things. But of course, traditionally, in the Han Dynasty, causality wasn't about pharmacology. It was about resonance. It was about the qualities that things had and the way that things with similar qualities influenced each other, not by chemical pharmacology, but by resonant causality. And there's a famous saying from a Chinese politician, actually, I think he was, Deng Zhongshu, who said a very classic saying that when you have two guitars in a room and you strike the shang note on one and stop that, another guitar, the same note in the room, another guitar in the room with the same note will vibrate on its own. And the Chinese were fascinated by that way that things connect because they are similar. That's really what the whole of five-element causality is about, that the way that they understood the whole of nature was as a resonant causality. And so it's not simply about pharmacology. This used to make no sense in pharmacology. 20 years ago, if you said this to a pharmacologist, that low doses might have bigger effects than higher doses, pharmacologists would just think you were completely mad. The world has changed, actually. When I did some pharmacology at medical school, and we did this sort of thing, we'd take bits of animals. We used to take rabbit intestines and put it in and these would, you could cut them out of the rabbit and they would go up, contract by themselves, and you'd pour a drug on top and they'd contract some more, or pour another drug in there and it would slow down. That was typical pharmacology in the old school. You get a dose-response curve where the more you give, the stronger the response is, and eventually you don't get any more response. That's kind of true when you take bits of animal and pour stuff on them. But then we had Benveniste, the famous homeopathic researcher who was a professor of immunology, and he was using different dilutions of substances and measuring the response. And he claimed to find a dose-response curve that went like this when you went into homeopathic doses. And so to simplify that, he was saying that at some doses you get a low response, and at some doses you get a high response, but if you continue to take the dose up, you get a low response again. Now, fair enough, this man was discredited, his paper in Nature was withdrawn, he was vilified, he lost his job because nobody liked this sort of thing. But since then, it's sort of come back. And this is now called non-monotropic receptor-mediated dose responses. Non-monotonic, that's to say a different shape of curve is emerging in pharmacology. This one actually comes from toxicology, looking at endocrine disrupting chemicals in the environment. And what you find is that in tiny doses, you get a low effect, in microdoses, but as you take the dose up, you get more toxicological effects. But then, if you take the dose up higher, the toxicological responses go down again and then up again. You see that? That's interesting, isn't it? Because that's agreeing with me, which is good. You can challenge this, by the way. What I say is just what I think. It doesn't necessarily mean it's complete fixed truth, but I'm here to make you think, in a sense. That's what I'm hoping to do anyway. So that's interesting, isn't it? We can have a dose-response curve that actually changes with doses. So there is some science. There's also the subject of paradoxical pharmacology been discovered. I think about 15 years ago, they discovered that pharmacology doesn't always work in the way that you expect it to. So it was well known that you couldn't give beta blockers for blood pressure to patients with asthma because it would make their asthma go worse. And eventually they found that if you give a small dose of beta blockers for a period of time, it actually makes their asthma better. So that's paradoxical pharmacology, where you can get the opposite effect to the one that you expected to get. What am I saying? What am I saying? I'm saying that the way the whole system works is not the same as a piece of rabbit gut. When you take a frog heart and take it out, you can measure something happening. When you take a bit of rabbit gut and pour chemicals on it, then you get a certain kind of view of reality. But when we take whole systems that have got nervous systems and immune systems that are adapting and changing things, then when we're dealing with complex systems, complex things happen. So we have to consider appropriate dosage. And in my view, a low dose is something like 0.5 gram to 3 grams a day. And this is something we would do where we know that this person can't change in the space of a week, 2 weeks, 4 weeks or so. A standard dose, standard Chinese hospital dose would be 3, 6, 9 grams a day of most herbs. And a high dose would be perhaps 9 to 25 grams a day. And we give a high dose, in my view, when we're aiming to get a pharmacological effect. If you have a patient with a frank pyogenic infection and you give tiny doses, it's not going to work because you want the pharmacological antibiotic properties. My wife, Marianne, a couple of years ago got bitten by an insect in the garden, and she developed cellulitis in one leg, and that cellulitis was red and swollen and spreading up her leg. I think it was on a Sunday. We couldn't really go to the doctors or anything, so I made a Chinese herb prescription of things like Zhehua Ding and those antibiotic herbs, and I just gave her like 30 grams of each of the herbs in there, and you could watch it from the first dose. You could actually see it retreating back down. But if I'd done a microdose there, I'm pretty sure that wouldn't have worked. So for things where you need pharmacology, where you're having a pharmacological effect, then I think high doses are needed. So some patients react badly to standard doses as well. I think you just retreat straight away. If a patient says, that made me feel really unwell. I had a patient hallucinating. I gave her a Chinese herb. I couldn't believe it, but we tried her again, and she hallucinated again. And that was we traced it down to Shurchangpu, and she said it's great. I was seeing things completely. God knows what was happening there. Tone it down. Relatively mild chronic diseases will use low dose. Only slow change is realistic. Long-term phlegm, long-term damp problems, where we're gradually trying to ease it away. To some extent with blood stagnation as well. You can't usually make chronic blood stagnation like you might see in endometriosis disappear in a week or two. You've got to allow a few months for things to change. And complex pathology as well. So we can use patents, we can use powdered whole herbs. One of my favorites is frozen decoctions for low dose because it's got the chi, it's got the freshness of those herbs, it's convenient and it's quite a cheap way to do things, and concentrated powders. Standard doses is quite a useful thing as like a pawn to king 4. Let's see and do this as an experiment, and we'll just do a standard dose and see what happens with a view to upping the dose or reducing the dose. We do it in acute diseases, serious diseases, or where we expect a response to show in a few weeks, or even before that, even in a few days. If you're using Wu Weizi for the pharmacological effect of lowering liver enzymes, then obviously you want to use a high enough dose to do that. That's a pharmacological kind of effect, using herbs for antibiotic properties, to bring serious disease under control, or when lower doses have failed to work sufficiently. So this is just my view. This is just what I've learned, and I'm happy to be wrong. I quite like being wrong, actually, because I learn things really well when I'm proved wrong. It's so unusual that it really sticks in my mind. But I think just simply giving 10 grams of everything, as they tend to do in Chinese hospitals, is a bad thing. I did give this session once to a plane load of Chinese doctors who were brought to England for a conference, and I was the token Westerner speaker brought in for entertainment. So I thought I'll entertain them. So I did this gig there, and their faces. I had a Chinese translator on the rostrum with me, and there was one guy in the audience who was the head of the All China Pharmaceutical Association. He was the uber boss of pharmaceutical medicines and Chinese medicines, and he got his own interpreter from the BBC sitting next to him, giving a simultaneous translation. And I've got 200 Chinese doctors in the audience shaking their head, and when they looked at that football referee case, they said, "Oh, a dose for 1 day, yes?" No, 10 days. And they were, "Oh my God, this is terrible." And the funny thing was, my eye met the really old Chinese doctor, very experienced doctor, and he was saying, "Yes, you're right." And I thought that was really interesting, that the basic level workaday hospital doctors in China are following the rules and believing in the rules, but those with more experience actually become more flexible with experience. So 10 grams of everything, I think, is a bad habit, and that we should, as part of our diagnosis and part of our intake, we should deliberately focus on what is the most appropriate dose to have. It's about appropriateness. Okay. So we can't teach that. That's all I'm going to say.